All right, good evening, everybody, and welcome to Books and Books in Coral Gables. Thank you all for coming down tonight. This evening, Books and Books is very happy to welcome Ms. Rachel A. Sapoznik and her new book, A Passion for Wellness, Healthy Employees, Healthy Bottom Line. Ms. Sapoznik is the founder, CEO, and president of Sapoznik Insurance, one of the largest insurance agencies in South Florida. She has been recognized as an industry expert and has received several awards, including South Florida Business Journal's Top Insurance Agencies, Influential Businesswoman of the Year, and the Commonwealth Institute's Top 50 Women-Led Businesses in Florida. Yeah. In this book, Ms. Sapoznik unveils a blueprint for businesses to rein in healthcare costs. She provides employers, business owners, CEOs, and leadership teams a guide to understanding how they can impact their employees' personal health, specifically from a wellness perspective. Here to tell us more about it, please give a very warm welcome to Rachel A. Sapoznik.
Thank you, Victor. First, I'd like to thank Books and Books for this beautiful, warm welcome and fantastic bookstore. It is really something wonderful to see. As Victor mentioned, my name is Rachel Sapoznik. I am born and raised here in South Florida, in Miami, native Floridian, and very proud of that. I was very blessed in 1987 to give birth to my second son while working at a very large insurance company. That blessing came with one thing. I got fired from John Hancock because now I had two babies in the house and I was not able to maintain the quotas that were required to stay with an insurance company. Being a two-income family, I had to figure it out pretty quickly. So it was the beginning of what was now we all know as HMOs. And in 1987, Humana came into our market and started to sell a product called an HMO. And everybody was, what is an HMO and how does it work? And I suddenly realized that I found a niche. And that niche was to really start to educate people about their choices of the different types of health care that was out there. Whether it was an individual policy through an indemnity plan, where you could go to any doctor and be reimbursed through the insurance companies, or this new concept. And the new concept was a health maintenance organization where individuals would select a doctor, and that doctor would then be their primary care physician. I took the chance and started to cold call and started to really see who could I educate. And I had an opportunity through this cold call, because it does work, to get an appointment with a very large hotel. And when I got that appointment, I was very blessed when I worked at Hancock to have an excellent mentor. And I called Gloria up and I said, Gloria, what do? I have this opportunity to go to a hotel and bid on their insurance. In 1987, for those of you that may not know, cell phones were just coming into the market. They were extremely expensive, and the average person like myself could not afford one. So we were using regular phones. So she said, Rachel, just go over there, get the information, and I will help you put this together. She was a woman of her word, and she did that. I was able to meet with the hotel, pick up the information, bring it back to her, and she helped me. A couple weeks later, I went back, had the presentation in front of the board, the executive board of the hotel, and we were able to save them 20% on their premium with this new concept called an HMO. The hotel manager loved the idea and felt that this was a direction they would go in. I've got two babies in the house. If I get this account, I will now have enough income to probably rent an office. Very excited about the opportunity, and of course you wait. The next day after the HR director presented to the executives, he called me up. And he said, Rachel, we loved all your ideas, so my heart's racing. Okay, this is going to be this is going to be it. My heart's racing, and we're going to get this account. But then you get the however. However, we have a long-standing relationship with our current broker, and unfortunately, we're going to take your ideas, but we're going to stay with our current broker. So, having to think quickly, I said to him, can I come see you? I could get there in 10 minutes. So he gave it a thought, and he said, you know what? Yeah, come. So I called Gloria before I leave, because, of course, I don't have a cell phone. I said, Gloria, this just happened. What do I do? She said, go over there and ask them a question. Ask him if you could introduce voluntary programs and teach people about voluntary life insurance, voluntary disability insurance, and come in there and educate them about HMOs. So I ran over there and I said to him, would you mind? I understand and I appreciate the fact that you're so loyal to your current broker. And I know one day, when I become your broker, you'll be just as loyal. Having said that, would you mind if each month I'd come here and teach your employees, housekeeping, waiters, managers that never have an opportunity to learn about insurance because no one's knocking on their door? Can I come each month and educate them? And he waited a minute and he said, you know, I guess I could. I could let you do that. I said, I need one favor. Most of these people don't have paychecks or checking accounts that they can easily write a check to. Would you be able to payroll deduct them each month on any of the things that they purchased? And he said, okay. So every month I went there, and anyone that knows anything about the hotel industry knows that the typical cafeteria in a hotel is in the area that they call the dungeon. You have to go through some very interesting areas to finally get to the cafeteria, but I went there every month. And I was able to educate a community that really never had an opportunity to understand what life insurance and disability was. And at the end of that year, he came to me and he said, you know, everybody loves you and they ask you questions. You're always helpful. You even help them with their health insurance, even though you're not getting paid. So I've gone back to the executive committee and I've asked them to make you our broker. So after 1 year, I became the broker of a very large hotel, and they did stay loyal to me for 17 years until they sold the hotel to another very large organization. The point of the story was that was really the impetus for me to understand what direction I wanted to go to when I started my insurance company. Because by really getting that account and writing that account, I was able to leave the house. I was able to have the kids go into daycare, and I was able to open up my own office. It was a little office, mind you, but I was able to at least start the company. And with that, I realized that insurance is not really what you're selling, it's what you're teaching. And you need to teach people what the needs are. And as my business continued to grow, and as I was able to get more and more clients, I realized that people really don't understand how to maneuver through the system. It's become a very difficult system to maneuver, understanding medications, understanding how to get procedures paid for, and really understanding the plans. And that education kept morphing. And we would bring in not only the insurance companies, but we started to bring in doctors, nurses, to educate employees about their plans. We wanted them to understand that they had choices. And as the evolution of the company, and we'll be celebrating our 30th year, really started to move, we kept expanding the education part of it. And that finally came into a full-blown wellness program. The wellness program that we put together for our clients is really for people to understand that we, as Americans, as human beings, have to be responsible for our own health care. It is through prevention that we will be able to have a sustainable health care plan. Unfortunately, right now, we are seeing that healthcare costs are skyrocketing, and they're coming from things that are really preventable. the chronic diseases. So I'm going to read something to you, and it's called The Economics of Wellness, which is on page 25 of my book, just to highlight, who is driving the healthcare cost. Who's driving healthcare costs? Statistically, we know that 5%, now think about that, 5% of your employees are driving 50% of your total healthcare costs. And between 70 and 80% of these healthcare costs are preventable or reversible, according to the CDC. 60% of employee absenteeism is related to psychological issues, job stress, according to the American Psychological Association. So if we start to think about this, 5% of the people are driving 50% of the cost. Think about how that's going to impact our country as we move forward. When you think about this, really how it impacts all of us, if you start to understand what's going to start to happen in the future, we're going to be looking at a society that will have no choice but to ration care. And that, to me, is what's so startling about what's happening. If you see what happened in England this week, just Monday, there was an announcement that the NHS made that they are in such dire straits in England on their healthcare system because they have a national program that they are going to have to shut down hospitals and reduce the number of doctors substantially. Now, England only has 65 million people, and they have not been able to control their healthcare cost. We are a country of 350 million. Imagine when the healthcare costs really start to skyrocket, and we're going to have to ration each person and make very, very difficult decisions as to who should get treatment or not. For example, in England, if a woman is diagnosed with breast cancer, she does not get the latest medication because they feel that medication is so expensive and only adds 2 years to that woman's life. They feel that the cost is not worth the results. Well, if that woman is your mother, if that woman is your daughter, if that woman is your wife, 2 years added to that life is priceless to you. But you've got a country that's saying, no, it's just not worth it. That will be our future if we don't get a handle on healthcare costs and really become responsible for our actions. If you think of what the preventable diseases are, it is obesity. Obesity is one of our biggest issues. Here in Dade County, I sit on the Education Fund in Dade County, and we monitor this. Over 30% of the students from 12th grade and below are either borderline diabetic or have diabetes. Think about that as a society, that 30% of your youth already are starting with a major medical condition. And think about how that generation will teach their children, because these kids obviously are learning it from someone. And they're learning that nutrition is not important because they don't have time and they're rushing through their meals. It's very important for us to really take a look at how and where this all comes from. And it's the nutritional supersizing, it's the type of foods that we're eating, and it's the lack of exercise. For those of you that were born in the 60s like me, we had something called the Presidential Seal. And we used to go to high school and we would compete. We needed to run, do sit-ups, leg presses, and through that we would get points. And those points awarded us a seal of physical fitness. Well, that was eliminated. And physical fitness now in schools are basically voluntary, which is a very big issue, and we're seeing the results of that coming in, having more and more students being unhealthy. So another area that I'd like to bring to your attention in my book is the ACA. What's the ACA? We at times call it Obamacare, but it's called the Affordable Care Act, which was implemented several years ago. The ACA came about in part as a result of Americans needing a way to control the rising cost of health care after decades of neglecting their personal health and preventative wellness. We need to remember that and continue the transformation from sick care to well care. I know we can make the transition because we've proven it possible by implementing wellness programs that educate employees in the workplace. We've seen the numbers. We've seen the ability to take an unhealthy employee population and transform it into a culture of prevention. We've seen employees taking control of their bodies and taking control of their health. We've seen the immediate change in the perception of their benefits are viewed. So what we're trying to do as an agency, and what I've really tried to implement, is to really bring awareness to the employees of what's going on. Most people think that if you have health insurance, most employees are using it. But sadly, they're not. And I will here to tell you that most employees don't go to the doctor. They wait. And they wait too long. So we've taken the approach that why don't we bring the medical professions to the employer so that the employees at least can find out, do I have high blood pressure? Do I have diabetes? Do I have a weight problem? And by bringing this awareness through the employer where we spend most of our time, we suddenly find that employees start to care. There are many times when we bring the nurses in that the nurse actually tells the employee, well, you've got one of two choices. You need to go to the emergency room now, or we'll call rescue. It's your choice. Because their blood pressure is so high, and they had no clue. Because they had no clue, they had taken no medications, they had no understanding that high blood pressure could result in a heart attack, could result in a stroke. The average cost of blood pressure medicines, $20 to $30. The average cost to a heart attack or a stroke is hundreds of thousands of dollars. And that's why you see the statistics, 5% cause 50% of the claims. And that's the area for me that's been so frustrating with all the politicians. Because when they talk about health care, they don't talk about personal responsibility. They throw the responsibility onto the employer or someone else. But the reality is, we as individuals choose to be overweight through what we eat. We choose to smoke. We choose to drink too much. We choose not to exercise. We are making these tough decisions even worse for the future by not understanding that we're not in this alone anymore. I have clients that tell me, well, I don't want to wear a helmet. Who cares if I'm wearing a helmet? Well, everybody cares, because when you get into an accident and you didn't wear that helmet, we're all in it together. And that accident now causes the entire population that works with that person that chose not to take care of themselves, not to wear that helmet, everybody's healthcare cost goes up. And I think there needs to be a better understanding that healthcare is individual by choice, but national by results. So what you do individually affects all of us nationally. And the purpose of the book was really to create a roadmap of how employers could implement wellness programs at their place of work, how their employees, what their employees would need to understand how to move forward, how to give and create incentives to employees to participate in the wellness program, and how to really move the health insurance program from something that people consider as sick care. When you ask someone, why do you buy insurance? Why do you buy health insurance? well, God forbid if I get sick, if I have a heart attack, if I get cancer. My goal with a passion for wellness is to change the paradigm and have people say, I buy health insurance because I want to stay healthy. I'm going to go in for my wellness checkups that are covered 100%. I want to understand what's happening in my body and how I can prevent the heart attack and the stroke. I want to look at my health care as well care and have employers really implement and bring programs into fruition for them so that the employees can start to get healthy. As the employee population gets healthy, that will then trickle down to their children. Because as children get healthier, we're going to be able to move that pendulum that is now in very dangerous territory of claims. So these are the things that really have awakened me as a goal and a drive as to where and how healthcare has to change. Another area that I think is really important is the power of prevention. The power of prevention. And we saw it with one of our clients, and she wrote this for the book, and I'm going to share this with you because at the end of the day, I really feel we saved her life. I've worked in the human resource industries for over 25 years. Throughout my career, I've learned to apply a lot of what I share with my employees into my own life. Every time I sit with an employee to speak about their benefits, I remind them about the importance of their annual checkup. This message is something our employee benefits agency, Sapoznik Insurance, continuously stresses throughout the year, making a direct connection to prevention and medical claims reduction. Recently, I discovered firsthand exactly how fortunate I was to have followed my advice. During what I thought to be a regular, routine annual mammogram, something much more serious was discovered. My physician announced a devastating piece of news no one is ever prepared to hear. You have breast cancer. The news was delivered, I am certain, in a manner in which my physician has delivered countless times, as if simply stating the time of day. After allowing myself several moments to process what had been revealed to me, my mind began to race. The question arose, and the concerns followed. In the days following my diagnosis, the shock began to give way to gratitude that the cancer had been detected early through an exam that many women bypass due to lack of time or countless other reasons. In so many ways, the push for early detection, Sapoznik Insurance and I so passionately promoted to my employees, saved my life. It is my own personal experience that an extremely busy work life makes keeping physicians' appointments difficult. I can tell you that after my diagnosis, I will no longer play the let's cross the bridge when I get there game. Wellness is my mantra, thanks to my current employees at Nature's Product and Sapoznik Insurance, who partner to provide our on-site wellness biometrics and education, along with the constant reminders of how important it is to be and maintain your health. Wellness is something we should all embrace. It is the food for the life of preservation. Early detection saved my life, and I hope whoever reads this realizes that cancer or other medical issues do not discriminate. And this was an employee of one of our clients that really transformed her life, because it was a very aggressive breast cancer, and had it not been detected earlier, she probably would not have survived. So the fact of the matter is that we all have choices, we all can make a difference, and it is in our best interest as a society to start to understand that we as a country have to get healthier. We as individuals need to take personal responsibility, and we need to start changing the way we look at healthcare into something from sick care to to well care and start to take care of ourselves. I hope that through this book, and my goal through this book is to really teach employers. The biggest pushback I get are from the CEOs, is from the managers, from the owners, because for some reason they feel they can't make a difference. And I'm here to show them through a roadmap that this difference that they can make will create more profits for them, because anyone that has a healthier work environment, anyone that has healthier employees are going to have better employees, more productive employees, and employees that really care. That's going to create a better bottom line for them. So I am encouraging all employers to really embrace this idea of wellness and give their employees the time, the 20 minutes out of the day, once a year. And that's really all it takes, is 20 minutes so that they can get an assessment. That assessment can change their life, can change your claims experience, can change how your benefits are renewed and taken a look at. And it's really absolutely important to consider implementing these type of programs. So they've asked me to kind of give you an overview, which I hope that you felt this was significant, and to then open it up for any questions, so that I would love to answer any questions for you at this time, and have any type of discussion you'd like to have as a results of healthcare. Yes. Well, I think that we need to understand our plans. So under the high deductible plan, which is usually called a health savings account, an HSA, the deductibles are high. However, there are caveats to that deductible that many people don't understand. There are lists that every carrier will provide you of what they consider wellness. And wellness happens at different times as you get older. So, for instance, let's say you're a newborn. As a newborn, you're going to have a series of tests, immunizations that you need to have. Even if you're a parent that has a high deductible plan, your child will be covered 100% and will not need to meet that deductible. So it's very important to understand that. As you get older, there are also annual checkups. Then you might have mammograms, PSA tests. All of these things have a schedule that the FDA has approved. Those scheduled items that are considered wellness will be covered 100%, even if you have a high deductible plan. So don't be afraid of the high deductible plans. Understand them. Also, when you have a high deductible plan, which is very important to understand, you receive all the discounts that the insurance company negotiated. It's another area that people don't really understand. What that means in its simplest forms is that the doctors have negotiated their contract with the carrier. So hypothetically, you have your insurance, let's say with Blue Cross, and you go to that doctor and it's not wellness. You have a high deductible plan, it's not a wellness visit. You're not feeling well, and you haven't met that deductible. That doctor could bill you $250, but they have a contract with, let's say, Blue Cross at about $75. You're only responsible for that $75. You are not responsible for the entire bill. And that's an area that we educate people about all the time because they get very afraid of that aspect of it. Well, there are times when, and it does become very confusing, but there are contracted amounts that the labs are receiving from the insurance companies. And those contracted amounts have been negotiated by their corporate offices. Now, there's work to pay a claim and to receive monies from the insurance companies. You have to hire somebody. They have to file the claim. They have to submit the claim. There may be documentation they have to submit. So there's a lot of layers of work that may happen with that lab. Now there's another person that comes in with cash. And just like anything else, cash is always king. So they may discount for cash. So it's a matter of how you look at it. But the reality is that the insurance companies have done a very good job of negotiating the pricing. And we also have to remember that the insurance companies have to make up for those people that are not insured. So when someone walks into a hospital, hypothetically, and they do not have insurance, someone's paying that bill. And it's coming from multiple sources. It's not just the state. It's not just the county. The insurance companies have to put money into a pool to pay for the uninsured. So there's a lot of dynamics that happen that impact how and when claims get paid. So I don't know if that answered your question, but I'm hoping. Mm-hmm. Okay, so that's a great question. I will tell you, so the question, if you didn't hear it, is can you compare prices when you're looking for services in the healthcare field? Many years ago, you could not. It was this blind item that you really were not able to find pricing. But now each of the carriers have what's called a costs tool. And that tool allows you to go online, let them know what the procedure is or what the service is, and in there they will give you the estimates for the area. Even with pharmacy, there is a website called GoodRx, and if you go on to GoodRx and you put in the prescription you need, the area you live in, they're going to tell you all the pharmacies that have that prescription in their actual pricing. So we have become more and more transparent. Not only can you find out how much the procedures are, but you could find out how the doctor rates against his peers. So if you're going to have open heart surgery or you're going to have a back surgery, you could actually go into the system of your carrier and they will rate that doctor and let you know how that doctor compares to their peers. So we have become more and more transparent through the technology that is available today. Thank you. No, actually, it was part of the Affordable Care Act of really having all this information online so that people could make informed decisions when going to try and have a procedure done. Even MRIs, just to give you an example, a simple example of an MRI, and this could save everybody money. When a doctor says to you, you need to have an MRI, you as the patient have a choice. If you have an MRI at a hospital, versus a freestanding facility. If you go to a hospital, and they're all great hospitals, but an MRI is a piece of equipment. That equipment has to be calibrated, and there are inspections, and in the same inspections that occur at a hospital happens at a freestanding facility. If you have the MRI at a hospital, you're looking at about $1,800 to $2,500 in cost. If you have a high deductible plan, you're going to be picking up most of that cost. If you go to a freestanding facility, you're looking at a cost of $300 to $600. So again, what we need to start to become are consumers of healthcare and start to ask questions. You can ask your doctor, can I go to a freestanding facility to have this MRI done? 99.9% of the times, they're going to say, sure, no problem, because it's the radiologist that reads it. It's the radiologist that's going to read that MRI. And the radiologist really doesn't really matter where he's reading it from. So we, as consumers, can start to drive costs down by asking questions of where you can have a procedure done or how and when to use a hospital versus a freestanding. Another great example is urgent care versus emergency rooms. And if you go to an emergency room, if you wait too long, and that's the other area that I'm trying to, through the passion for wellness, when we wait too long to go to the doctor, we're not doing anyone a favor, particularly ourselves. We're hurting our plan, we're hurting ourselves, and we're hurting our country because people end up 70% of the time in an emergency room for non-emergency events. The cost of an emergency room here, Dade County, runs about $1,500 just to walk in the door. Now, start getting some tests done. You're looking at about a $2,500 spend. You go to an urgent care center, it's about $75. If you went to your doctor, you're looking at about $50. So every time we walk into that emergency room, we are hurting the plan because we're going in there for things that are for non-emergency events. Now, what we're going to start to see, and you'll see in the next 2 to 3 years, telemedicine will take over. Now, most of you have health insurance with any of the major carriers. You have telemedicine already in your plan, but you're not using it. Very few people are using it because it's the same as when the banking industry said you were going to do everything online and you were not going to go to the bank anymore. Again, my generation, being born in the 60s, was, are you kidding me? I am no way going to put my social security number out there on the web so that everybody can find it, and I will, of course, be going to the bank. This technology thing is no, no, no. Well, as we know now, I have not visited a bank in years. I don't even know where it is. I don't know if they have drive-through anymore, but it doesn't really matter. Medicine's going to go the same way. And you will be going to the doctor on your cell phone, on your iPad. Your visit will be a visit with your doctor through technology. You will be able to make your appointment from your office, from your house, from your golf course, tennis. You will have your appointment. You will log into your phone, log into your computer. You will speak to your doctor. You will see your doctor. You will tell your doctor how you're feeling. And 90% of the times, the doctor can diagnose you without him touching you. Most people think that the doctor has to take your blood pressure and they have to take your temperature. You will have all that equipment at home. And what we're going to see in the future is that these services will reduce healthcare costs and give you much more choices. It is at the beginning stages, but I would venture to say in the next 4 to 5 years, you will not be going to the doctor's office for any of those minor issues that you go to now, like a cold or a rash, an eye infection. Those will be dealt with from your home or office. And the doctors will be then freed up to be dealing with the more extensive issues. So technology, I believe, is going to bring a very exciting transformation to healthcare. We need it as a society because by driving those healthcare costs down through technology, we'll be able to service more people. One of the biggest issues we've had, unfortunately, with the ACA is we did not prepare for ACA. We did not consider having more primary care doctors. What we could have done, and what should have been considered, was possibly opening up borders to some of those countries that have the same medical philosophies as the United States or better, because if you go to France, if you go to Italy, they actually have better systems there than we do. We are not considered the best in healthcare in the country, in the world. We're actually, unfortunately, rather low on the totem pole. So if we would have opened some of the borders up and brought in more primary care physicians, we would have been able to service more people as they were coming in from healthcare reform. But unfortunately, we did not. And as a result, if you look around this town and any town that you're listening from, you're going to see more and more urgent care centers being open. Every corner has an urgent care center. You have to ask yourself why. Follow the money, because there's not enough doctors. And as a result, you're not going to have continuity of care. That is a big detriment to wellness, because continuity of care, such as if someone has high blood pressure, the doctor needs to follow you. But if you're going to an urgent care center each time to take a Band-Aid of medicine as opposed to really finding out how to resolve it, you're going to see a spiraling of people getting unhealthy. So my recommendation really is to really find yourself that primary care doctor that you can have a relationship with, that will create continuity of care and allow you to have that healthy lifestyle that you... Listen, we live in the greatest time, the greatest country in the world. There's no reason for people to not have the opportunity to stay healthy. It's all within our hands to do so. It's our choices. Now, yes, there are times that are way beyond our control. Sometimes it's genetic, family histories, accidents. Things do happen. People, unfortunately, are diagnosed with cancer. That is a small percentage compared to where the costs are coming from. The costs are really coming from those areas, as I mentioned before, that we have a choice. The area of nutrition. Believe it or not, your mom was right when she said eat an apple a day. It's true. You know, it's important to have that Mediterranean diet where you're having olive oil and nuts and real food and staying away from the chemicals, because all of that starts to deteriorate your body. So those are the things that I think are extremely important. I feel that as a country and as a society, rationing of care will be the downfall of this country. It will be the downfall. And we still have a chance. We still have a chance as a society to move and change that. But it's going to take every single person looking at themselves and saying, what am I prepared to do to make myself healthier, to make my children healthier, to make my family healthier? And now we've no longer, you know, as a company, I don't really look at myself as an insurance company anymore. I really look at myself as a wellness company. I look at myself and my employees and my staff and my team. We have 65 people that go out there every day talking to people about how to take care of themselves. And I see that as a mission. And our mission is to get people healthy and to understand how important it is. We have seen, unfortunately, too many people that we love get sick or have something that could have been preventable. And once it's already out of hand, to try to get that person back to where they need to be is very difficult. So I think that in looking at why the book was written, it's written precisely for those people. It's written for every single person to say, you know what, I can make a difference. And we can. We see it. It's unbelievable how we've had individuals that were overweight and realized through our biometric screenings that they could change. We've had police officers, and our greatest pride is the police officers that we take care of. We've put them into boot camps. We got them on nutritional programs. We got them healthy again. And these guys are getting awards now. Their blood pressure medicine is off. They are feeling better. And it just took about a bit of awareness for them to move in that direction. So I think that, I'm not sure how the time is going, but I think I would like to just close with, once again, if anybody has any questions, but I'd like to close with the thought, as each one of us walk out of here tonight, to think about how you can make a difference, who you could educate, because it's not just us. Who else can we educate to have them understand how healthcare impacts all of us, and how we're going to work together and understand that your health affects every single person in this country, affects each one of us as we move forward. And it's up to us to really think about what's the next steps. What are the next steps when it comes to healthcare? And imagine a world, and we have two choices. Imagine a world where your life is being decided by the legislature, where your life is being decided that you will or will not get the medication because of financial reasons. Or we suddenly become a healthier society and we don't have to go into the direction of rationing. If you look at what happens in Canada, to have open heart surgery today is anywhere from 3 to 6 months waiting period. If you want to get a hip replacement, it's about a year. I have clients, if they're going to have open heart surgery and the doctor says it's going to take a week, I'm getting a phone call. What do you mean a week? If they're going to have a hip replacement and it's going to be anything more than a few days, they want it done. That's the society we have grown up with. And are we willing to give that away? Are we willing to give away what we have that's so precious because we don't want to take care of ourselves? Well, that's what it is that we're looking at. We're looking at that very issue. We're going to look at the issue of breast cancer and not getting the best medication because the society does not have the money. But we could change it. And the way we're going to change this is through a paradigm shift on how we think of healthcare. We must think of healthcare as well care. That's the direction we need to go in as a country, as a society. And I believe that once we do that, you'll start to have a healthier society. And it's a mission of mine. I sent every politician my book. Haven't heard from them, but I did send it to them. And I want them to start to change what they're saying. And I really, really believe that we can make a difference. And I want to take this opportunity to thank Victor. I want to thank Books and Books for allowing me. I want to thank Books and Books for the opportunity to really express myself and allow me to educate what it is to have a passion for wellness. And I hope that those of you that came, I want to thank you all for your support and continued participation in creating a healthy, wonderful society for the greatest country that we live in. And thank you very much.
All right, folks, then if there are no more questions quick message for our internet audience watching at home. There is still time for you to call the number on your screen, and you can get a Passion for Wellness shipped wherever you are in the United States free of charge. The shipping will be free of charge. The book you still have to pay for. For those of you here in the house, we have the book for sale at the counter in the front room over there. Rachel will be signing here at the table to the left of the podium. And this has been just a really fascinating presentation. Please give another hand to Rachel Sapoznik. Thank you. Thank you very much. Very good. Very good. And I think we're off the air right now.